and welcome back to the Beauty Lab podcast. I'm your host, Monina, and my co-host, Velia. And today's topic is going to be all about hair loss as we age. Hey, Velia, are you ready?
I'm ready.
Okay, so I'm noticing a lot about this topic. People are Googling it a lot. I even have lots of clients talking a lot about hair loss. Mm-hmm. You've mentioned it a little bit in the past, but I think today we need to do a deeper dive. Mm-hmm. So I have a couple of questions.
Okay. Welcome to the Beauty Lab podcast, your drive time resource for all things beauty, health, and wellness. We're your hosts and favorite beauty nerds, Monina and Velia.
Join us as we debunk myths, explore the latest trends, and dive deep into the science behind your favorite products. We'll interview industry experts and answer your burning beauty questions in 30 minutes or less. All right, first one is, what are the different types of hair loss?
Okay, before I get into the answer to that question, I have a ton of notes because I don't want to forget anything, but I have been putting off talking about this topic because it is such an in-depth topic, and I wanted to make sure that I had as much information as possible before I shared anything, because of course it's a question I get every single day from every single client. And I want to say that, you know, we tend to go to like the quick fix when we talk about hair loss. So instead of accepting that we are all, 100% of us are going to lose some hair, not a ton of hair as we age, we tend to go to these, you know, to these magic potions and silly gadgets that we see on TikTok and Instagram. So I would like to encourage every one of you to start learning how to accept that your hair is going to thin as you age. And I'm sure there's somebody out there who's like 70 who's like, I still have a full head of hair. Congraturitos. I'm sure it's still less hair than you had when you were 25.
Right.
You know, that's just how it works.
And it's an emotional topic.
It's an oh yeah. Oh my gosh, it's an emotional topic, yes. And on top of just accepting and adapting, you can be preventative, and I will talk about that today. So, the different types of hair loss. Okay, so this is a big one because there's a lot. I'm going to cover 5. So alopecia, you hear that word a lot. Alopecia is the technical term for hair loss. And there are several different kinds of alopecia. The first one is androgenic alopecia. So androgenic meaning androgens. Androgens are male hormones. Females have them, males have them. And this type of alopecia is influenced by genetics and hormones. So men, this is like when men have the receding hairline or the thinning at the crown. And women tend to lose their hair kind of sporadically all over versus like patches, kind of like men.
Is that like a DNA thing, males and females?
Yeah, and mostly, you know, it's not so much that as we age, as women, our androgens don't necessarily increase, but more so our estrogen decreases, and it's throwing off the balance of our hormones. So that's why we start seeing this sporadic hair loss. And it's more even, you know, it's even throughout. That is androgenic alopecia, and that's really what everybody is going to experience. So that applies to everyone. Some of these aren't going to apply to everybody, but I think everybody knows somebody that these all apply to, and more than one can apply to you. So the second one I want to talk about is alopecia areata. And alopecia areata is patches of like balding. So it's an autoimmune response, and your hair falls out in patches like the size of like a quarter, or even I've seen them even larger. And the treatment is a steroid injection from a dermatologist. If you experience any kind of alopecia, you should go see a dermatologist if you're concerned. Your hairstylist will know some things, most likely, about alopecia, but they're not going to know everything, and they can't treat it. They can only advise you really on what to do, or explain to you what you might be experiencing.
So if you're experiencing alopecia type of symptoms, you'd want to talk to a dermatologist.
Yeah.
Okay.
And, you know, more specifically, I would try to find a dermatologist that's that specializes in hair loss, because not all of them do. In fact, very few of them do. So that'll help you the most if you're really concerned about something that's going on. The triggers for alopecia areata are usually from a virus or a bacterial infection in your body, not like on your scalp or on your face, because alopecia areata can also affect men's beards. So if you have like patchy, and this is like a bald spot, not a thinning spot, like it just went from all your hair was there to no hair was there in this one spot. I saw a lot of this during like peak COVID. So if you've gotten COVID or if you've had the COVID shot, totally saw this a ton. The most I've ever seen it in my 26-year career was in the last 2 years.
Now, this is the alopecia areata you're
Correct.
talking about. So is it reversible?
Yes.
Oh,
Yes,
okay.
it is reversible. You could choose to do nothing and not go see a dermatologist, and it might regenerate, like your hair might regrow on its own. But I've never seen it not get worse in that situation before it gets better. And on average, I've seen it take about 2 years if you do nothing, if you don't get treated. If you do get treated, it immediately will stop the spread, or it'll significantly slow down the spread, so it won't get bigger before it gets better. And the injections are, they're not pleasant. They're injections into your scalp where you're, in the area.
Or the beard. like
Or
you're saying.
your face, exactly.
Yeah, okay.
And
Yeah, that does not sound pleasant
No.
at all.
nobody has ever reported back to me that that was a good experience for them. However, their hair grows back really quickly. In my eyes, really quickly. In their eyes, it took forever. But in reality, you can start seeing regrowth in a couple of weeks, and then it will fill in, within a couple of months, usually.
So with the alopecia areata, is the hair loss like in clumps like that, where all of a sudden it's just a bald spot?
Yeah,
Oh, wow. Okay.
yeah. And I wouldn't necessarily say that just one day that entire spot fell out. It's never personally happened to me, so I can't talk from experience. And it's funny because most women don't even know they have it until I point it out, because it's usually in the back of their head. Now, of course, if it's like on the side of your head, which it can be anywhere on your head, then obviously you'll notice it. But the ones that are in the back, like they don't even know until I say, hey, do you know you have this spot back here? And that's when they get it treated. Yeah. So it could be like a week of just excess hair falling out, and you maybe just think, oh, that's kind of a lot of hair, or that's more hair than usual. Nobody's ever come in and said, I felt like a whole chunk of my hair fell out. Can you check my head? No one's ever said that. So it must happen
Over time.
but like, completely bald spots between appointments, because,
Right.
4 weeks or so.
Yeah. Okay.
Yeah.
Got it.
The third kind of alopecia is called telogen effluvium. And basically that's excess shedding, where the hair in the anagen phase, and I'll go into what that means in a second, the hair in the anagen phase abruptly goes into the telogen phase and noticeable shedding occurs. The anagen phase, so I can't remember what episode it was, but
Yeah.
it's the hair growth episode. I talk
Yes.
all about the different phases of hair growth, and the anagen phase is your growth phase, and your hair is in the anagen phase for 2 to 7 years. And so that's the phase where you don't want your hair falling out, because that's where it's actually gaining length and getting longer. It's not supposed to be falling out yet until it's done with its anagen phase, and then it moves into an in-between stage, and then finally the telogen phase, where it's actually falling out. So any hair that you see shedding, that hair was just in the telogen phase. So telogen effluvium, it's triggered by metabolic stress, hormone changes, and medications. So examples of these things are crash dieting. You just had a baby, so big hormone changes like that, right? Like most women lose with about 6 months or so after you have a baby, you wind up losing a bunch of hair around your hair. It's always around your
Always
hairline,
around the
and I don't
hairline.
know why, but that's where it is. You started or stopped a usually estrogen hormone abruptly. hypothyroidism, a significant iron deficiency, and major surgery. Those are all reasons why you would experience telogen effluvium. Some of the medications that would cause this are beta blockers, retinoids, anticoagulants, carbamazepine, and some immunizations. So it's usually not permanent. If you can figure out what caused this hair loss to happen, it's usually pretty obvious. I mean, obviously, if you just had a baby, that's what caused it, and it's completely reversible.
So you just mentioned it can be caused by retinol use. Did you just say that? Which is very interesting because I had a client a few weeks ago tell me that as soon as they put her on retinols, and she has a lot of hair, she noticed a significant amount of hair all of a sudden coming out. Like a lot.
Wow. And retinols oral?
I believe so.
Yeah, that's it's usually internal.
It's internal.
So like if you're using retinols on your face, I wouldn't expect that you would have this reaction on your scalp.
Yeah.
But if you're oral, then
yeah, because it was interesting that she said that that was the only thing that she changed and realized that's when she stopped using it, her hair came back to normal.
wow.
So that had been the first time I'd ever heard that, but now you're saying it as well. So wow, so much when we see things on our hair and our face, so much of it is internal.
Yes.
And we don't even realize it.
Yeah.
So,
the good thing about telogen effluvium is that it is reversible. Again, as long as you figure out what's caused it, stop doing that or fix that or...
So that one is caused by some kind of trigger. So as soon as you stop the trigger, then the hair goes.
Exactly.
So just so I understand, so this particular one, what is it called?
Telogen effluvium.
Telogen effluvium. So what you're saying is the anagen phase.
Yes.
That's normally the hair growth phase where it can be from 2 to 7 years.
Correct.
So what you're saying is, let's say that piece of hair was supposed to grow for 6 years, but now you're cutting it in half and it's going directly into the telogen stage from, let's say, 6 years and it's going to 1 year and it's just falling out. Is that what you mean?
Well, it depends on where that hair is in its growth stage. So if that hair, when you start losing hair, if that one strand of hair was only growing for 2 years instead of up to 7 years, it went from 2 years to gone.
Okay.
Yeah. So whatever, and every strand of hair is in different stages. Otherwise, we'd all just be bald and then we would regrow, right?
The same rate. Yeah.
That's why we can lose a lot of hair, even with telogen effluvium, and still have hair on our head. Yeah.
Right.
So
good to know.
yeah, you don't lose all your hair. You just lose a lot of hair abruptly. Okay. The fourth kind of alopecia is called traction alopecia, and this is much more prevalent in the black hair community, because they tend to wear their hair pulled really tightly for long periods of time. So this is hair loss due to constant pulling and tension on the follicles by wearing your hair in really tight ponytails or tight braids for an extended period of time or every day. Now, this isn't obviously only in the black community. Everybody can have this. And depending on the trends, sometimes the hairstyles are really pulled back tight, and then sometimes they're just really loose. So just be careful when the trends change and you decide you're gonna do like really tight, like even cornrows. And speaking of cornrows on hair that isn't black hair, it's so much harder. You have to pull so much harder to actually be able to get your hair to stay because it's more slippery. So if you don't have that like kinky, curly, textured hair and your hair is more straight and slippery, you're having to pull twice as hard to even get your hair to go in that style.
The tension's higher when your hair is more slick and slippery.
Yeah, and then what we do is we wind up, to try to control it, we wind up wetting it or dampening it, which makes our hair more elastic, which makes it, when it dries, when it tries to retract, it pulls even harder.
Even more.
So what happens, why that causes hair loss, is the follicle over time will be inflamed. And when that inflammation goes down, you hope it doesn't leave scar tissue behind, because when that scar tissue is there, no hair can grow.
Wait, you can have scar tissue in the follicles?
Yep.
Wow.
That is literally what traction alopecia is. It's scarring
Wow.
of the individual follicle.
Okay. Comment if you knew that. I had no idea. I mean, I'm into skin. I didn't know.
Yeah.
We get scars.
And you won't see them.
Right.
It's not going to look like, it'll just look like balding. It'll start slowly, and, you'll start seeing like if it's, your hair is being pulled back all the time from the front, you'll start seeing a receding hairline.
So if it's a scar issue, then that's not reversible.
No.
Wow.
No, there are treatments that you can try, but in general, no, it is not reversible. If you catch it early, like if you're like, oh my gosh, yes, I have started to see, maybe I'm making it up, but maybe there's some truth to it, that I'm starting to see some like receding hairline because I'm always wearing my hair pulled back. If you stop when you think you might be starting to notice it, there's a chance that it's reversible.
Okay.
But if you're like
so you got to try to catch it before that scarring overtakes the hair follicle, basically.
Yeah, exactly. And a lot of times you can tell, like if you part your hair and put your hair in a really tight style, like 2 braids or a bunch of braids or whatever, you can see on your part line that your part line is starting to get bigger.
Getting bigger.
Mm-hmm.
Wow.
Yeah.
Okay.
Yeah. So that's traction alopecia.
Okay.
Okay. Last one. Last one is called cicatricial alopecia, and that basically means scarring alopecia. Cicatrix, the word cicatrix is actually used in gardening sometimes, or like tree trimming, because you can see, like if you cut off a branch, you can see like the scar of where the tree branch used to be, because it won't grow back there. So that's where the cicatricial word comes from. It's an inflammatory condition, can be autoimmune. Sometimes it is, sometimes it isn't, but it can cause pustules and redness and swelling and itchiness that actually kill the hair follicles. And it is permanent. It is definitely an emotional, if you have this, it's very difficult emotionally to deal with. I actually have 2 cousins that have dealt with this, and it's hard. It's hard to get treatment. The treatments are usually oral steroids, and everything. I don't even want to talk too much about it, because this particular type of alopecia is not very common. So most people won't relate to this. And if you have this problem, you've definitely been under doctor's care. And actually, if you haven't been under doctor's care and you have this problem, you should consider talking to a doctor who specializes in this type of alopecia specifically, because it will only get worse.
So is this one and the one right before with the tension, they're both self-inflicted?
This one is not self-inflicted.
This one is not?
No, this is not. It's usually autoimmune, or it's from trauma or an infection directly on your scalp.
Got it. Okay. So that's kind of on, as far as severity, that one seems to be the most severe.
Yes.
Okay.
Yeah, that one's the most severe.
That one's a hard
traumatizing.
one. Yeah. Okay. Wow. Yeah, I can see, this can be very emotional.
Yeah.
I mean, first of all, hair loss is never fun, but when it's something you had no control over, like the last one,
exactly,
it can be very, very hard, because like you said in the beginning, you have to get to the point where you're just accepting where your hair is at, and that could be hard, you guys, and we understand. So
yeah, we do.
Yeah. Hopefully this episode helps you figure out if you're in any of those categories, and then most of them are reversible.
Yeah.
Except for that last one. But that last one you still need treated. You need to still be working with a doctor.
Correct.
Dermatologist in particular. Okay. Wow. So good. So much info. All right. Well, I have a second question.
Okay.
As if you didn't cover everything. I do have another question. So, can clogged hair follicles due to poor hygiene, can that be a cause for hair loss?
Yeah, I mean, definitely if you are not cleaning your hair well enough and you're using a lot of, let's say, dry shampoos or even just heavy products in general, it can cause folliculitis, which is an inflammation of the follicles. And folliculitis, if left untreated, can absolutely cause scarring and permanent hair loss. So yes, I mean, does that mean if you don't wash your hair every day, are you going to start losing it? No. You're going to make it easier for bacteria and other things to grow on your scalp if you're not using good hygiene.
Yeah, because it's all about the health of your hair, the health of your scalp, the health of your skin, right? So if you're not doing your daily hygienic steps, then all those other things can start to happen. And now that we understand scarring can happen, that I hope that helps you guys realize your hygiene is super, super important.
Yes, and we never want to scare you, or give you reasons to be anxious about your beauty routine.
It could be another trigger for hair loss.
Right, exactly. Don't make me worrying about your hair falling out. Make your hair fall out.
Exactly.
But just awareness, because there is a lot of bad information out there and silly things that we see that are actually can be harmful if you don't know better.
Yeah, I think what I wanted to point out is, the whole purpose of the show is to give value, to educate you guys so you can make those educated decisions for yourself. And, when she says silly things, things like, for some reason, we started to talk about not washing our hair regularly.
Yeah.
As if that was a good thing. And we deep dive on that in another episode. I can't remember which one. But yeah, hygiene for your hair is super important.
Yes.
So, but if you have other questions about any of the different types of alopecia that she mentioned, please reach out and let us know. Leave us messages, or please let us know if you talked to a dermatologist and this episode helped you in any way, shape, or form. On that note, please share, like, and subscribe, guys, because with you coming on here and reviewing and leaving us comments, it really, really helps us continue to grow and so that we can continue to come here every week and give you guys value. So if you have any thoughts or enjoy what you see every day, please share it with other people you think might benefit from it. All right, so I got another question for you. Are there treatments for hair loss? You kind of talked about that, but do you want to talk about any other types of treatments?
Yeah.
Okay.
So typically for androgenic alopecia, so the one that everyone's going to experience, there's a couple of treatments. So for women, there's a pill now, a minoxidil pill. So remember Rogaine, the product Rogaine? So the active ingredient in Rogaine is minoxidil. So that's what we'll see now because their patent ran out, so everyone can have minoxidil again, right? So minoxidil is either topical in shampoos or it's a pill. And I have my personal hesitations about the pill because anytime you take a pill for hair growth, your hair can grow anywhere.
Oh, so hair growth can happen anywhere on the body.
Exactly. So you kind of don't always know where it's going to grow.
Oh.
I think that it's probably formulated to have the best success of growing hair on your head.
On your head.
But your face is part of your head. And I have definitely heard from women because the pill is actually new. So I've heard from women who started using the pill that they're noticing hair growth on their head, but they're also noticing hair growth on their chin and things like that.
Yeah, and we're talking about hair loss as we age, and so we know as we age, the whole hormonal stuff starts to happen, and we're already starting to see hair growth in places we don't want, like our chin or parts of our face. So now you're saying if you take this internally,
there's a chance.
There's a chance.
So
to
you're
grow
saying
it more on places you don't necessarily want.
Exactly. And then for men, there is a pill also called finasteride, and it works a little differently. It's a hormone blocker. It's a DHT blocker. So, but the minoxidil wakes up the sleeping follicles that were once in the telogen phase and they never went back into the anagen phase. So that's what happens with hair loss over time, is that the anagen phase goes into the telogen phase, and then typically within a couple of weeks a new hair grows where the old hair shed like a tooth. And as we age, that starts to happen slower and slower, and then eventually like our follicles just got way too sleepy and never wanted to wake up. And so the minoxidil goes in and they're like, hey, wake up.
Okay, so the anagen phase, there's no limit to the anagen phase, or like as we age, does it have a certain lifespan? Will you just, certain follicles just have a certain lifespan and they've done their anagen phase for the millionth time and now it's done and you can't wake it up? Or
kind of.
Okay.
Kind of. I mean, that's one way of looking at it. I'm sure there's more nuance to it, but yes, essentially some hair follicles will have their last anagen phase and it won't ever go back into the anagen phase after it goes into the telogen phase.
Yeah, so even though you're taking these treatments, if that hair follicle is just done, its lifespan is done, there's nothing you can do about it.
Yeah.
Okay.
Yeah. So if it's asleep, you can wake it up. But if it's dead...
Is that what those caps, those red light therapy caps, is that what they're trying to do, is wake up the anagen?
The red light therapy is trying to actually stimulate hair growth. So stimulate the follicles by increasing circulation and blood flow. There are more treatments. So those are like the medication sort of treatments. And then there's laser therapy, which red light therapy I would say is like your at-home treatment as far as laser therapy goes. But then like if you go in clinic, you'll have a better laser. Yeah. We can't have access. We don't deserve access to
those types of lasers.
To those types of lasers, right? And then there's hair transplants, which is really kind of squeamish to talk about for some people, but basically they take a section, obviously it's a surgery, it's a major surgery. So they remove a section of your scalp and then a small section, and then they harvest your healthy follicles from that section of your scalp with like this really tiny hollow needle, and they basically take it out and they insert it into your bald spots, and that's what hair plugs are basically.
Wow, so it's from your own scalp.
Yep.
They're just harvesting it and implanting it in the bald spots.
Yeah.
Wow.
And I have known people to have done that, and they have had various degrees of success with it. They've all had some success, and I'd say the one person I know who has had that, let's see, about 30 years ago, still has some healthy hair plugs left.
Wow.
Probably about 100.
Wow.
I think they do like
a lot.
Like I guess it depends on what area, how big of the area they're trying to cover.
Right, exactly.
And then now there's a new to me, maybe it isn't new. It's called PRP. It's platelet-rich plasma. You've heard of this?
Yes, because that PRP is actually what they call the vampire facial.
Oh.
Using platelets to put on your face. Yes. But go ahead, talk about that.
So it's injecting concentrated platelets from your own blood into your scalp. Yeah, to try and nourish. Yep.
Yeah, makes sense. Yeah, it's the same concept for the vampire facial.
That's crazy.
Yeah. We may have to talk about that in another episode.
Yes, I want to know about that. Vampire facial. Okay.
So those are
so those are basically all the treatments.
Okay.
Those are all the treatments that are mainstream. I'm sure there's other things out there.
Okay. Well, I have one more question. I don't think we've covered this. You may have, but my question is, what can we do to then prevent hair loss? Are there certain steps, tips and tricks we can do to prevent the hair loss that you're talking about?
Yeah, so preventing hair loss is absolutely where you want to be. This is even if you're not experiencing hair loss yet, you want to do everything you can to prevent it, because once it happens, it's much harder to deal with
Sure.
And it's going to happen, but you can soften the blow and increase your chances of experiencing the least amount of pain as possible, right? Emotional pain.
Emotional pain, yeah.
I remember, quick story, I remember when I was like 13, my mom handed me a little pot of, she didn't hand me pot, she handed me a little pot of eye cream. And I was like, what's this? She's like, start using this now. And I was like, I'm 13. And she was like, I know. But when you start getting wrinkles around your eyes, it's too late. And I was like, oh. So preventative is always better, right?
Prevention.
Yeah, exactly. Being preventative. So, okay. So how do we prevent hair loss? So keep your scalp really clean and stimulated. So stimulation with a brush, with your fingers, massage. You want to keep your scalp stimulated because hair growth feeds on blood flow and circulation. So we need as much blood flow and circulation to our scalp in order to keep healthy hair growing. Okay, keep your stress levels in check. So if you're stressing out about losing your hair, stop doing that because it's going to make you lose your hair. Okay, get enough sleep. Okay, a lot of this stuff has to do with hormones, and anything you're going to do to be preventative with keeping your hormones in check is all, I mean, aside from massaging your scalp, is going to help your chances of decreasing your hair loss as you age. Eat lots of protein-rich foods. First of all, eat. Okay.
You have to nourish your body in order to nourish your follicles.
Yeah, we're back in this kind of swing of everyone needs to be super skinny. And I get it, it's a trend, but we can't starve ourselves.
Right.
Okay, because of so many reasons, but if you're worried about losing your hair and you're starving yourself, you're going to lose hair. So protein-rich foods, iron-rich foods, zinc. Some example, we all know really what protein is. I don't have to give you examples of protein. We all know what iron-rich foods are, okay? Zinc, beef, chickpeas, pumpkin seeds, okay? Lots of zinc. Biotin, eating biotin-rich foods. Eating vitamins is always better than taking a supplement, but biotin, eggs, nuts, avocado. Omega-3s, vitamin C, vitamin E, and drinking lots of water. Keeping your scalp hydrated will always increase your chances of healthy hair.
Okay.
Yeah.
So I'm going to recap. So a couple of things, right, is number one, good hygiene.
Yes.
Number two, nourish your body. So eating all these good nutritious foods and maybe some supplementations like your vitamins, like you were saying.
Yeah. Supplements are great, but eating
it is better than, okay. And you also mentioned stimulating. Can you give us a couple of examples of how to stimulate your scalp?
Yeah, so massaging your scalp with your fingertips. 5 minutes a day. It can be a vigorous massage if you like that. Of course, you don't want to pull your hair. Like, let's be, realistic here. And brushing your scalp. That's another one. That does two things, actually, that will remove buildup that could potentially clog your pores and cause all the things that we talked about earlier. But also, it stimulates blood flow.
Okay.
And using like a scalp scrub would work really well, again, to remove impurities and anything dead, skin, all that kind of stuff off of your scalp. And it also just gives you a little extra like exfoliation and stimulation on your scalp.
All right. Awesome. Wow. This was so informative, and I can see why you hesitated to just start talking about it from the get-go, because there's so much involved, and there's the whole emotional aspect to it. And I know we usually joke and try to have a good time, but today's topic was on the serious side, obviously, because it is an emotional thing. We hope that you got some value, and if you feel like what we talked about today can benefit somebody else, please share it with other people. Now, I do have one more question that's from our audience.
Okay.
Because we also encourage you guys to please send us your actual questions, because we could talk about things all day long, but we want to make sure we're serving you, and the best way to do that is to let us know what it is that you guys are interested in learning. Okay, so the question from our audience is, you kind of touched on this, is do supplements for hair loss really help?
Okay, so the thing about supplements for hair loss is they're not going to promote new hair growth. Okay, so remember I talked about the sleeping follicles? They're not going to wake up the sleeping follicles. So if you're looking for something to give you more strands of hair, then supplements are not exactly going to do that. There's no proof that they've ever been able to do that. What they do is they give you the strands of hair that are already going to grow the best chances of being healthy and strong and like give you like the building blocks of the protein. A few of them, like biotin, which is basically vitamin B7, that aids in the production of keratin, and our hair is made out of keratin, and that's the protein in our hair, our nails, and our skin as well. And that works best. Like, I know a lot of people just take biotin, but it works best in people who are like deficient. So if you're not getting enough B vitamins, you know, I named a few things: eggs, nuts, sweet potatoes, avocado, then take a biotin supplement. Okay, so if you're already feeling like you eat a lot of that stuff and you take a lot of vitamins and stuff, you might not see any changes if you take biotin. It's not going to hurt. It might make the hair on your face that was once not coarse, it might make that a little coarse. But aside from that, it's not going to hurt. Collagen is another one that we see a lot. Collagen. There's several different kinds of collagen, but the collagen that's for beauty, like collagen peptides and that kind of stuff, those are structural proteins that provide structural support for the hair follicle and the hair strands. As we age too, our hair strands start to miniaturize, so they start to get less coarse. So if you think of each individual hair strand, the fatter the hair strand, the stronger the hair strand, and if it starts getting little like smaller in diameter, the more weak it is, and then it can
more susceptible to breakage and hair loss and everything else.
Exactly. So that's what collagen is going to help. It's not going to make new hair grow.
Okay.
But it's going to make the hair that's growing better quality.
Healthier.
Exactly.
And also, based on what we just talked about, the supplements, it's not going to hurt you, but don't expect it to cause new hair growth, is what you're basically saying. And it's not going to help if you don't have good hygiene and you're stressed out and you're not nourishing your body.
Yes.
So it's not a one and done. We learned that about everything. Hair, skin, and nails, not a one and done. It's the whole body. We have to take the whole body into consideration.
Yes. And then right now there's a product called Nutrafol.
Yes, and I see that a lot.
It's a big one. And Nutrafol is a nutraceutical. It's not a medication. You're not going to have to be prescribed Nutrafol. It's a supplement that really works on balancing your hormones in a natural way, like with all different kinds of natural ingredients. There's no medications in there. And it does also contain marine collagen, which, you know, is a collagen that does exactly a structural protein.
Right. So the Nutrafol is basically more of a supplement for, let's say, women going into premenopause or menopause, because it's actually helping with the hormonal balance. Okay.
Yes.
I didn't
Which
know that.
really does help. You know, if your hormones are balanced, you know, that's a really big hurdle to get over, because most of this hair loss that we, you know, unless, you know, the most common forms of hair loss, androgenic hair loss, is hormone induced.
Okay.
So if your hormones are balanced, which, you know, as women, it's much harder for us to achieve that because our hormones are always out of whack.
Right. So if you are in the premenopausal or menopausal phase and you're losing hair, the Nutrafol sounds like the one supplement you want to start looking at.
Yes. Okay. I would say there's nothing in Nutrafol that I'm like, okay. But just know that it's not going to wake up the sleeping follicles and create new hair growth. It's not a medication.
Right.
Yeah.
Good to know. I didn't know that about Nutrafol. So, wow, guys, I learned a lot, and that's what I love about this show. Even though we've been friends forever and we talk shop all the time. I'm always learning just as much as probably you guys are. And again, thank you so much for being with us every single week. We really, truly appreciate it. And again, if you find value, please share, like, subscribe, and take some time and maybe even write us a review. We'd really, really appreciate that. Well, I'm Monina.
I'm Velia.
Until next time,
Keep experimenting with your beauty routine.
All right. Okay.
That's going to be me. I'm going to Okay. Okay.
Wow, that was good.